Hi, Dr. Gilbert.
Yeah.
Okay.
Hi, this is Dr. Gilbert. No. All right. Oh, ready. Okay. So the type of cancer you have is very common. It arises from the cells that are in the wall of the rectum. It's called a glandular cell or adenocarcinoma. And when we find these in the rectum, there are two approaches depending on how advanced it is. For the very limited kind, which is what you have, there are two choices. One is to do kind of a semi-radical surgery where not after the biopsy they take the whole area of the rectum and margins deep. The problem with that is when it's a lower type of tumor in the low rectum, you might have to have a colostomy, you might have to have something diverting. It's a major deal. But again, when it's early like yours, the other choice is to be more conservative in the surgical approach, and rather than extensive surgery using radiation external, where we put a field of radiation in that area, give you 25 treatments, 10 minutes a day, 5 days a week for 5 weeks, and with it some chemotherapy, which helps the radiation work better.
And the chemo is like through IV?
It can be, or in your case, there is an oral form of it. Dr. Lee will discuss the different options. The main chemo that they use, 5-FU, is an easy chemo to give one way or another. She'll talk to you about which one she recommends in your case. But it's all done at the same time over the same 5 weeks.
So after I go here, I go to her.
You're going to go to her and she'll make the recommendation, and then we'll start the actual treatment about the same time.
So it's like after here, go there. After here, so the chemo is it?
No, you don't have to go to her every day for the chemo.
Oh, it's like once a week or something.
Yeah, usually once a week, or if you're taking the pills, you just take the pills once a day.
But the pills, you lose all the energy. I heard.
Well,
depends.
Even with the radiation, you get tired.
And lose your hair too.
No, not usually. Well, talk to her about which chemo she's going to give. I don't want to make a statement because at certain chemos you don't lose your hair. And keep in mind that it's all temporary no matter what. The radiation is down here, so there's no hair loss from that. And certain chemos, you don't lose your hair, but if you do, they all come back. So it's temporary. All the hair comes back, not the chemo. All comes back. The hair comes back. But the type of chemo that we're talking about is one of the easier ones to take.
Oh, that's good.
And in doing that, then we are treating like a major surgery, that whole area. We're really giving radiation and chemotherapy to that whole area.
So we'll kill all the cells.
Yeah, you don't need, exactly. And so you don't need any further surgery.
Does it kill brain cells or no?
No.
Okay, that's good.
You get to watch the Super Bowl with your full facilities and say, why are the Dallas Cowboys not in it again? No, you'll be fine that way.
All right. Okay.
So what we're going to do today is what's called the setup. And the setup is that we do our own CAT scans, CT scans, at the end of the hall. And just from that, I can mark the area that we need to treat and create a field. You'll see Dr. Lee, and we'll determine through her when she wants to start, and then we'll start the radiation about the same time. And today is Wednesday. I suspect that we're talking about not next week, but the following week.
Okay, good.
Okay.
Cool. Thank you.
Side effects from the radiation.
Oh, no.
You may get some diarrhea. So get some Imodium, over-the-counter, Imodium, AD, anti-diarrhea, to keep around. So if you get some diarrhea, just take that, and that should shut it down. Some tiredness, I mentioned, is possible, and that's about it. I don't expect, maybe the skin a little bit.
Irritated?
irritated. And
So just put lotion or something.
aloe vera gel is the best thing.
Aloe vera gel.
Yeah.
Okay.
Or if you have access to an aloe vera plant or something, you break the leaf off and just use that. And that works the best. There is also Anusol with hydrocortisone, which you can buy. Try the aloe vera gel. That may be enough.
All right.
And everything heals up. Within 3 weeks after we're done, everything should be back to normal.
God willing. Yes.
God
Definitely will.
Okay.
Amen.
Signing off.
Thank you, sir.